We're going to be breaking down the good and bad of cholesterol. We've talked about cholesterol before, and Dr. Dall is back with us now to sort of break down new guidelines, I guess.
Yeah, well, we'll talk about the guidelines, which in my opinion, I personally don't endorse, actually. And I've been a lipidologist for, since 2005. New cholesterol guidelines came out in November of 2013. And what they basically did was something pretty bold and threw away targets of therapy for LDL cholesterol or non-HDL cholesterol.
What do you mean by that?
So we used to have recommendations that, for example, if you've had a heart attack, your LDL cholesterol should be under 100, or more aggressive therapy would be under 70, for example. And now they're basically saying is it doesn't matter what the number is, just if you're high risk, lower your LDL 50%, and if you're more moderate risk, lower it 30%. But my biggest concern with the guidelines, which were based on just a limited number of randomized controlled clinical trials that sort of fit into the perfect box of a clinical trial, but many people are not represented in that group. So there's children who will never have studies like that on. There's women who will never have studies like that on. And basically what it's done is put people into 4 different risk categories and said basically the treatment of choice is a moderate to high dose statin.
So it doesn't matter who you are, if you're a man, if you're a woman, if you're a child, what your age is, if you fit into that box,
if you fit into one of these 4 risk categories, so you have known heart disease, you have diabetes, and your LDL's over 70.
Then doctors are being told put them on statins.
Basically use statins. And what is really unfortunate is that they're recommending moderate to high dose statins basically in everybody. Now, I've been doing this for 15 years. I've been using advanced testing, which we have less of those types of trials that they're looking for, but certainly a tremendous amount of clinical experience and also a lot of data that the advanced testing does better predict disease, and we're just ignoring that.
Right, because what we know is that with advanced testing, there are some patients who don't need to be on statins.
Exactly.
Or don't do particularly well on statins. They need a different kind of therapy.
Exactly.
But the doctors don't know that unless they do the advanced testing.
Right. And what's been really unfortunate with these recent guidelines is that I'm seeing doctors taking patients off things like niacin, like other therapies, which I know in my practice have saved lives. I mean, there are people who are alive today who had heart disease 15 years ago who should not be on this earth, who everyone in their family died when they were young, who are alive because we've used a combination of therapy and the right type of diet and really personalized their care based on what their advanced testing told us.
What you said is so important. It's personalized care and personalized testing, because not everybody's the same. It's not one size fits all with anything. And hopefully, I hope, and I say this every time I'm with you, is that I hope that doctors start adapting to this idea of advanced testing, because it just seems like so many lives can be saved, and so many people can be off of medications that they're currently taking, which leads me to my whole soapbox thing about, some of the guidelines are there because it keeps the drug companies in business and all of that, because I think so much of it can be natural, lifestyle.
And I think some of the biggest issues are that, pharmaceutical companies have the money to fund trials. So I think just even the trials that we end up with, even if they're good trials, are going to be somewhat biased. I mean, for the last 15 years, what I've used more often in my practice, if I prescribe a drug, what I probably prescribe more often than anything else, even a statin, would be metformin, which is this medication that we use for diabetes, but we use it in pre-diabetes. It helps the cholesterol particles, it helps prevent diabetes, it helps people lose weight, it's very safe, it's generic, but because it's a $4 drug, we don't have all the studies to show the benefit. And many of these patients that the guideline
there's not a big push to sell it because they don't make as much money if you sell a $4 drug compared to a $400 drug, or
So it's really, this whole push toward using high-dose statins concerns me. Most patients who have come to see me over the years that are in my office in tears because they just had a heart attack and they're 52 years old and their cholesterol was perfect and they're taking 80 milligrams of a statin and their numbers look normal, but they come in saying, I just had a heart attack, I'm so afraid of dying. And we do advanced testing in them, and we know exactly why. We can see what it was that was triggering that, what was causing the disease, and then we know what to do. And more often than not, you know what I do? Is I cut the dose of the statin, usually in half, and then add things like niacin or metformin or other things that will be much more specific to what they need to individualize their care.
Do people get angry? Do your patients get angry when you do the advanced testing? And do they ever say, like, why didn't I have this? Why isn't this the test that my doctor recommended to begin with?
They get angry all the time, and then sometimes doctors get angry at me for having ordered it. So I think but we're getting better. When I think about the way it was in the late 1990s, I mean, we had very few studies. We really didn't have what we have today. So it's getting better. And even this is the first time I think ever on a broadcast we've ever talked about this, and the fact that you guys are doing that. I mean, you are so cutting edge, and you're getting the word out, and that's what we need.
Oh, we love it.
I think this is going to be a consumer-driven thing.
Yeah, I think so. And I think more people will be, watching the segments, calling and asking questions. I know you've already had phone calls and people curious about what y'all do there, but I just think it's great. So thank you for breaking it all down for us, because it is very complicated, most of this, when we talk about blood testing and everything that you can find.
So happy to be
here. But
here.
you make it much more understandable for us.